Do you know that you can ice your first ever interview that you'll be getting if you're planning to relocate to Ireland, the UK, the United States, Canada, Australia, name them. From any part of the world where you are, you just get your first interview and then you get it correctly and pass it at the very first trial. Yes, this was exactly what I did, which is why I have come in today's video to share my experience and to also share the experience of other people whom I have asked to share their experience, what it felt like when they were having their interview, what they did differently, especially for those who did not make it in their first attempt and they went ahead to get it on their second attempt. So if that is the kind of content you want to listen to, sample interview questions, how you can express yourself confidently during an online nursing interview, please keep on watching. And if today is your first time coming across my channel, my name is Nduweso. I am a registered nurse and I make videos like this. If you do not want to miss any of our content, please kindly subscribe and turn on the notification bell so you'll be notified whenever I post another video just like this one. So yeah, congratulations on getting your interview invite to be interviewed for that favorite staff nursing position of yours. Now, this interview question is going to cut across all specialties, cut across all areas of nursing that you might be intending to be interviewed for. Before we go into talking about the sample questions, let me give like a preamble so that you understand what are the necessary steps you need to take for a successful interview. Remember that this interview is going to be happening online, which is why you need a mobile phone or a laptop. And because you need these things, you need a very good network. So you want to walk around where you live. Make sure you know where you can have a very good network. If you don't have one, then you can go to a cyber cafe so you can get network. Because if you are not hearing them and they are not hearing you, then you might be having some misunderstanding in terms of communication, what you're answering, and the interview might not really go well. Next thing you want to do is to look into the app that they will be using for the interview. Majority of the interviewers now are using Microsoft Teams. So if this is your first time you'll be using it, you want to quickly download the app, register it. It just takes few steps for you to sign onto it, and then you can even try to create a team interview, like just a quick link with your spouse, your partner, your kids, just to test to know what it feels like for you to use the app for an interview. If they're using Zoom or Skype is more like an outdated so it's majorly Microsoft Teams because it's very easy to use, or Zoom. So make sure that you are in a very quiet place. If your environment is noisy, please, you can look for a hotel, you can look for cyber cafe. Just look for a place that is very quiet and convenient so that you can hear them and they can hear you. You want to also make sure that you log into the app way before time. I would say 30 minutes to the start time. Make sure you are ready, fully dressed. It doesn't mean that you go and do a lot of things. Just if you're a female, simple makeup, simple hairstyle, just look presentable in your Sunday best uniform. And if you're a male, just wear your Sunday best and you're good to go. Good haircut, and then you look presentable. Remember, it is a formal interview, even though it is happening online. It is very important for you to know the technique when you're answering an interview question, especially for nursing. The technique is called the STAR technique, STAR. Now, the S there stands for situation. When you are asked any question, you want to quickly get a scenario so that you can give the interviewer a kind of context for you to be able to explain better what you have in mind, and they will also follow you using that scenario. So that's what the S there, situation, stands for. The T there is task. So when there was this situation, what was intended for you to do? So that's what you are going to talk about there during task. And then in the A there is the action. What then did you do when that thing happened? You want to say what you did, how you did it, you just explain a few things with that. And then the last one, which is the R, is the result. After you have done all these things, what was the outcome of it? And then the interviewer will quickly understand that you actually know what you're talking about. So now that we have got all these things out of the way, let's jump right into the very first interview question that you may come across as a nursing staff. Now, remember, some interviewer may want to go through your CV, which is why I always say everything you have in your CV, please make sure that you can identify them, remember them, and you can defend anything. So on them going through your CV, they will start from, the professional summary. Remember, is when you give like a brief explanation of yourself, which is where they will get to like know your years of experience, where you've worked, if it is acute or if it is a long-term facility. That is what you were explaining in your professional case. So they will kind of ask, oh, you've been practicing for so length number of times, then you agree. Then they move into your skills, and then they look through one or two things that it might interest them, move quickly over to your qualification, any certifications you've had, and then your previous roles and responsibilities in different units or specialties that you've worked in. And then at the end of the day, they stick around at the area that is most relevant to the post which you are interviewing for. Now, when that is out of the way, the very first question that you might encounter will be, take me through a typical day in your life. So remember the technique that we talked about. So here the situation is going to be your unit. So if you've been working in different units, somebody like me, that some years I work in the clinic, some days I work in the theater, some years I work in the ward. So you want to give a context that, okay, in my line of duties, some days I happen to work in places like this. So if I were to work, let's say, in the ward, and I have patients that are going for surgery, so I'm trying to be making these things to look like more like a surgical nurse, so that sometimes you understand exactly what I'm talking about. Okay, so if I were to work in the ward and I have patients that are going for surgery, on arrival and I was on morning duty, I'll be taking over from the off-going nurse, which is the night nurses. Depending on what they have done for the patient, I need to first of all take over from them and then go ahead to introduce myself to the patient, telling them I will be the one taking care of them for the day. Now, this might not apply to everyone, so that's why you need to understand your unit. In some hospitals, you do not get to be shared to a particular patient. You just know that you're working in the ward and maybe you are the junior person there, so you are working under the directive of your superior. So your superior could say, go and prepare a patient on bed 3 for surgery. So if that is the case, also set that so that they can follow you through. Remember, the question was, take me through a typical day in your duty. On taking over and introducing myself to the patient, I want to look through what the night nurses have done already. If I need to mark the OP site, if I need to pass any catheter, if I, when you are setting an example that you've been working, you have so many things to talk about. So you talk about that, how you take the patient across to the theater, and then you hand it over properly. You wait till the theater nurses take the patient over from you, and then you go back to the ward, and then you wait for the surgery to be done, where you need to go bring back the patient if there was no surgery. So if you are talking about surgery, you could also mention the kind of surgery. Remember, these people that interview you are also nurses. They are not HR. They are nurses. They are all registered nurses. Probably, or let me say, the person that is currently working in that unit they are interviewing for is definitely going to be there. So when you are talking, they know what you're talking about. It's not like they are just assuming everything. They have all been practicing nursing for a very long time, sometimes even longer than you yourself. Okay, so you set example like that till the very end where you need to hand over. If you are a clinic nurse, you also want to talk about how you set your clinic, waiting for the patient, waiting for the doctors, how the patient arrive, you welcome, health education, stuff like that. Just the way you have been handling yourself throughout your day. That is what you're going to talk about. You might also get a question like, how do you handle conflict in your role with your colleagues? Now, remember, questions like this can throw you of balance. You know why? Because somehow you might be anxious that when you accept that there are conflicts between you and your colleagues, it may now make you seem like a bad person, but that is not the case. Remember, conflict is something that can happen. So like I said, you want to set a scenario for them to follow through. So you can start by telling them that conflict is something that is bound to happen, and most time these things are unintended, because you just go about your normal duty and you never can tell what you did that upset the next person, and sometimes the reason is well known. So when you have explained that, next thing is you want to set a scenario of a conflict or a misunderstanding you had with your colleagues in the past, and then you said how you handle them. Remember, when there is conflict, the usual way is, if you know that this thing is what happened, you need to approach the person and try to explain what happened. If it's something you don't know, then you ask. The person will now say their mind, and then you can apologize depending on what the issue is. So if it was something like, okay, maybe you walk past and they ask you for help and you couldn't help them at the time, then you can go on and explain, okay, please, I was busy, I got so busy with my patient, I didn't mean to keep you waiting for so long, I'm sorry, it may not happen again, please forgive me. Okay, so if it is something like that, if you pass the level of you being able to sort it out, sometimes they can go ahead to report it to the manager, depending on how you call your manager in your place. So sometimes it's like the in charge or the chief nursing officer or the assistant director of nursing, depending on your unit. So you explain that if it happens that way, then the in charge needs to call you, and then you explain your own side of the story, and then both of you can be called in together. You apologize and also acknowledge the fact that continuous conflict at the workplace is something that will hinder the care and services that you're rendering to the patient. And remember that all of you are there for the patient and not for you. You know, you see these instances and you just see that they are okay, because that's exactly what is happening in the workplace. Remember, interview is not something you should be scared of. It's just you telling them your experience, which is very, very important, and it's also the reason that you are likely to be interviewed for a position that you have had experience on, which means it is easier for you to speak about many things they are going to ask you. Now, the next question I'm writing out here is that you may be asked to talk about how you prevent infection in your unit. Remember, like I said, we want to set a scenario. Now, infection prevention is a general thing. It could be asked to anybody in every unit, because it is should I say, a combined effort. One person cannot successfully prevent infection in the workplace. So it is the job of everybody working, whether clinical or non-clinical staff. So in nursing, there are so many ways you can do. You start from your hand hygiene. It could be with your hand washing, could be with your hand rub, it could be with your patient placement, where you place patients that are highly infectious at the side ward, or you keep patients that are just coming out of post-op closer to the nursing station, where you keep people restricted to a certain work visiting hours, not a good number of people visiting patients. You could talk about disposal of waste. You could talk about, just pick the simple ones. Don't go to things that will bring more question that you might not be able to. Hand hygiene is something that is your gowning, face masks, face shield, hand gloves. Those are simple things that you talk about. And you also want to place a scenario like, okay, let's say I am caring for so patient, depending on the ward that you are. For me as an ophthalmic nurse, if I'm instilling eye drops, I do not necessarily need to wear hand gloves, especially if that patient is not a known infectious patient, because there's nothing really coming out or coming in contact with me that is fluid that can infect me or can infect the patient. So you want to set a scenario like that to be able to explain, and for them to understand that you know exactly what you're talking about. So from there, it could burst into something like methods of sterilization. Don't go into something that is outside your reach. talk about what is within your reach, which is first talking about maybe things like if you're in the clinic where you have like a simple autoclave, or you have like alcohol jig and then you soak it, you rinse it with sterile water or normal saline, where you just use single use items as single use. After that, you discard them properly. You could go into, at the end of your unit or the end of the day, then you pack the instrument and then send to the central sterilization unit. So all these things depend on your unit. So that's how you will respond to some of these questions. Okay, then if you are asked something about medication error, you need to be very serious and very, should I say, very calm in answering this one, so you do not jump point. So medication error, if you read through the NMBI manual on medication error, there's like almost a 2-page document regarding this. If you make a medication error, you need to, first of all, is that you need to own up to it. You need to own up to the fact that you have made a medication error. Then depending where you are, you need to let your manager know that this is something that have happened. Then there's what is called open disclosure. You need to explain to this patient that this is the error you have made, and because of this, so depending on the kind of error, remember our technique. So let's say the error is something like this: a patient was prescribed 1 gram of PCM and then you mistakenly give 1500 milligram, which is 3 tablets against 2, or depending on how the combination came or how the product came. Then after that, you explain to the patient, okay, you are supposed to take 2 tablets of the 500 milligram each, which is 1 gram, but mistakenly I gave you 3. So because I gave you 3, you could have increased side effect as to the usual ones that you should have if I was giving you the normal dose. So there could be increased abdominal pain, you could feel dizzy, you could feel like vomiting, stuff like that. So you explain, let the patient understand. And please, if you are experiencing any of these things, kindly let me know. This is a call bell. And if you are setting an instance within you, maybe something you have done before, but in this case, I will not say, go and say you've done it before, but just know that that is something that could happen. And then you let the managing team know. You have to write it down, update the patient's record. If you were closing, then you make sure you are handing it over so that the patient could continue monitoring it. And then depending on your hospital policy, you now complete the rest of the sentence, because there could be like maybe a form to fill, an incident form, because usually these things, there's incident form to be filled and then you fill and then submit. So that's how you handle medication error generally. So you just say that those are the guidelines that you know, and believe me, you are very correct if you say all of those things I just mentioned. Next question is, how do you handle pressure during a busy shift? Now this question could come if you are working, let's say, in a outpatient department, theater, even in the ward. The ward could be very busy, but it would be unlikely for you to get like sudden busy ward, because a ward is a place that admission is always planned. So sometimes it's not like an emergency that you have, except it is actually in the emergency unit, depending on the position you're interviewing for. So if you're asked something like this, I will use myself as an example. I work in the outpatient department, so sometimes we have influx of patients walking into the clinic and they become so overweighing on us. So what I do is just to relax and make sure I am calm, because when you are calm, you think more clearly, you know more how to maximize your time and attend to your patients correctly. Remember our technique. You're still going to say this so that you set a clear distinction about the kind of busy schedule you are talking about. Let's say back home, where our clinic would get so crowded because our patients are not booked. So in that instance, what I may have answered would be that when we have busy clinics like that, what I do is to tell the patient to be calm, and then they sit down, and then I start attending to the patient on first come first serve. When the next patient realizing that the clinic is organized, no matter how busy it looks like, they will remain calm, and then you'll be able to do your job. If you need to get help from somebody, maybe your other colleagues left you outside and then they're inside not knowing that it has become so busy, and then you can talk to the patient to get an excuse, and then you get help from those within the clinic. So those are the things you should do. If it is in the ward, then you need to know that you attend to patients that are critically ill first. Let's say your medication, you do that first calmly, and then you can go into wound dressing, you can go into maybe changing fluids, doing like some checks like drawing bloods and stuff like that. So that's why you need a scenario to be able to explain. And remember that your time management ability for you to be calm and firm, take a deep breath. If you need to call for help, please do when you're overly busy. Those are the things you can do when you are under pressure at work. And no matter how under pressure you are, you should not do things that you're supposed not to do, or you not do things that you're supposed to do. So if during when you are under pressure and then somebody, maybe one of the doctors just walk into you, do this for me, no. You can calmly explain to the person, I have so things I am doing. If that can wait till I finish this, then that is okay. But otherwise, I need to do this first. You need to be firm as well. Now, that brings me to the next question, that if you are asked by your manager to do what you have not been certified to do, what will you do? This is a very tricky question, but it is something that can actually happen, especially if you are new to the place and then you know someone older than you, I mean not in age, somebody older than you in that unit just ask you to do something. Sometimes you already know how to do these things. Remember, here everything is regulated. So if you know how to do something back home but you have not been certified to do it here, please do not do it. What you need to do is to calmly explain to the person that you have not been certified or signed off to do these things. Is it okay if you do it while I watch, and then maybe when you sign me off I can do it? Or I know how to do it but I have not been signed off. Is it okay if we can do it together while you supervise me? Because on no circumstances should you do something you know not to do, something that is above your scope, and something that you have not been certified to do unsupervised. Also, if you're going for the adaptation, let me quickly say this here. Even when you know how to do these things as a registered nurse, but you're under adaptation, remember, you're working under supervision, you must not do it without the supervision of your preceptor. Pre-approval and then supervision by your preceptor. Do not do it. Let them know that you're on adaptation, even though you know how to do it, but you would like to be supervised, because that is why you're doing that period of adaptation. All right, now let's move to the next question I may be thinking about, which is, you arrive a shift and you are the only one on duty. What will you do? Yes, what will you do if you are the only one on shift? Now, this could happen in the ward, in the clinic, anywhere. Or let's say you are not the only one, or maybe it's a place that is supposed to be like up to 5 nurses and you just see the 2 of you. What will you do? The first thing you need to do is to try to be calm, because if you get anxious and get worked up, then you mess a lot of things up. So when you are calm and relaxed, if you were the only one, then you know that you are now the one in charge. You need to sort your tasks that you need to do and do the things that are really important first. Explain to the remaining patients that you are the only one on duty, and because of that, you want to start to do these things first. Now, depending on your unit, you know the things that should be prioritized when you're caring for a particular patient in under your unit, or in your specialty, you know better. You explain to the other patient, and then you quickly follow your hospital policy with that. Don't forget to mention that. Follow your hospital policy when you are short-staffed or when you are alone on duty, which usually revolves around you calling like your nurse in charge if they are in the unit, or if they are at home. They could be like somebody that is covering your charge nurse if your charge nurse is not around. So you want to call them, you want to explain to them what's happening, if they can get you help. You could also call your next unit to tell them that this is what is happening. In case they are free, they can come in to help. And then while you are waiting for help, you start to prioritize your duties. You start to prioritize so that you'll be able to manage your time, maximize your abilities, and then make sure that no patient is at risk while you are working, which is why you need to attend to all the patient that needs to be attended for. Maybe like confused patient at risk of falls, which patient at risk of dying, or those that are actively dying. So depending on your unit, you know what you need to prioritize, and you must make sure that. Okay. And to the last question in this part, because I might be doing a part 2 about this, I have a lot of questions I've asked people, and they mention what they were asked. If a patient is not satisfied with a service, how will you handle the situation? So this could come if you are maybe working in outpatient or in a long-term facility where maybe you're doing something and they don't like it and they want to make a complaint. What will you do? Usually the route here is that you try to see if you can allay the issue as it is happening. So make sure you give them a listening ear, welcome them, give them the time or the chance to express themselves the way they want to. So do not constantly interrupt them. They come and say, nurse, I was supposed to get this, and they'll say, you don't say, no. So you have to be calm and relaxed first, welcome their opinion, allow them to say everything they need to. Then you see if if it is something that you right there they can solve it. If it is something you can solve, then that's fine, and you see that the patient is satisfied. If it is not something that you cannot solve, then you may maybe get another nurse or get your manager to speak with the patient. When your manager comes, and then he or she can speak with the patient and see if she can also resolve the issue. If it cannot, then the issue may need to be escalated to the hospital management board, and from there they will go into like an in-depth investigation of what happened, maybe during the hospital stay, when the patient was admitted, or when he was coming to get any procedure done. After which they will get to, depending on the hospital policy, maybe within 7 days or within 2 weeks, they will get to the person to explain the outcome of their procedure. If there is any updates, the person will be updated. They'll also get their contact details already. They have these things, and if he or she is not yet satisfied, he can go ahead to report the issue to an independent body, which is usually the ombudsman. So those are like the routes to handling complaints. And you also make sure that you follow your hospital policy. This is very, very important. I hope if you've watched up to this point, you like the video, and give this video a very big thumbs up, and drop any comments, questions that you have in the comments. I would do like a part 2 of this interview prep, because I have a lot of questions. I have asked people to say their experiences when they were interviewed, and I'm going to be saying all of that in my next video. And please keep on watching my channel, subscribe, share my videos, and I will see you back in my next video.